name is Debbie Houston. I am a licensed independent mental health practitioner. I've worked in acute inpatient psychiatric care for 23 years and in private practice for 18 years. If you are worried that your child or teen has obsessive compulsive disorder, I want to let you know that you can get help. All children have worries and doubts, but kids with OCD cannot stop worrying no matter how much they want to. These worries often compel them to behave in certain ways over and over again. OCD is an anxiety disorder. Kids with OCD can become stuck in thinking about something harmful, dangerous, or dirty, or wrong. They can become preoccupied with thoughts that something bad is going to happen to them. OCD is truly a fear disorder. Children with OCD get scary or upsetting images in their minds called obsessions, which are hard to shake. They might worry about things not being in order or being done just right. Sometimes strong urges will pop into their minds to do things repeatedly in order to get rid of the scary thoughts. They develop compulsive rituals to make extra sure that things are safe or things are clean. They want to feel absolutely certain that something won't happen or they have to do an action just right. Children and teens may not understand why they are doing these things, but they do realize inside that they feel better and less anxious when they do it. Most kids will tell you they know they don't have to repeat these thoughts and behaviors over and over again, but their anxiety may be so high that the repetition is required to neutralize their discomfort. While the child may feel a momentary relief once he engages in a compulsive ritual, participating in the ritual only serves to reinforce the obsession. OCD behaviors can make life difficult for children and teens. Their behaviors can take up a lot of time and make it harder for a child to complete such tasks as homework or to enjoy life. The child with OCD always lives with two emotions, dread and fear. They are constantly dreading the next time the urge will arise to engage in these same behaviors. They may also feel frustrated and guilty for not being able to control their own thoughts and actions. They often suffer from low self-esteem and shame and embarrassment. They might have difficulty paying attention or having concentration problems because of intrusive thoughts. The most common obsessions for teens and kids include fear of germs, fear of contamination, the need for order or precision, religious obsessions, preoccupation with bodily waste, lucky and unlucky numbers, sexual or aggressive thoughts, fear of illnesses or causing harm to oneself or others by touching them, intrusive sounds or words. The most common compulsions for teens and kids can be grooming rituals that include hand washing, showering, or brushing teeth, repeating rituals including going in and out of doors, needing to move through spaces in a certain or special way, rereading, erasing, rewriting, checking rituals to make sure doors are locked, or repeatedly checking homework, rituals to undo contact with a contaminated person or object, and touching rituals, rituals to prevent harming oneself or others, hoarding and collecting things of no apparent value, cleaning rituals related to their house or other items. How can you as a parent, teacher, or therapist help? It is important to understand that a child cannot stop OCD behavior by trying harder. Parents have not caused this behavior. However, it is important to understand that transition events in life can trigger some OCD behaviors. Things such as losses, a move, death of a loved one may trigger OCD behaviors. As a therapist, I wanted to write a book that captured the suffering as well as the answers for a child with OCD. My book, Mervous, Tames, OCD, is the story of a little boy about 10 years old named Mervous. Mervous suffers from fears of contamination and issues with order and symmetry. He feels compelled to keep his toys perfectly lined up and color-coded clothes in his closet, and must always write his letters perfectly. Mervous visits Dr. Deb, who helps him work to overcome the OCD bully in his brain. Dr. Deb uses cognitive therapy, exposure therapy, and response prevention strategies to help Mervous gain mastery over his symptoms. I have included an educational page for instruction about OCD to help parents and teachers and therapists talk to kids about this problem. At the back of the book, there are questions for discussion. I believe this educational tool will help anyone who is working with children understand this disorder and how specific therapies work to make a difference in the lives of children. This book can be purchased for $21.99 at www.xlibris.com/bookstore. That's www.xlibris.com/bookstore. Thank you.